Many patients come in for evaluation of ankle sprains, and one of the common things is, well, when do I go to a doctor for an ankle sprain? I usually feel if there's severe swelling and pain with weight bearing, it is worth coming in for evaluation. Thing that we look for, though, that would want to bring you into the doctor is if you're very tender over some of the bones around the ankle, either the bump on the outside of the ankle or the inside or at the base of your fifth metatarsal bone, which is in the middle of the foot. If any of those places are really tender, then you should be seen. With a true ankle sprain, we usually then start with either a boot wear or bracing to allow the initial swelling to improve. We'll then initiate a physical therapy program to help with recovery. It's only in very rare circumstances that we'll actually have to acutely operate on a severe ankle sprain. For someone that's really only rolled their ankle for the first time and is having a little bit of pain and swelling, this can often be treated at home without a visit to a doctor. You can initiate treatment on your own with what we call the RICE method, and that means rest, ice, compression, elevation. So getting your foot up elevated and a bag of ice on it, then using something like an ACE wrap or a compressive wrap that you can get at the store to apply some compression to the area that will make weight bearing more comfortable. Usually it takes about a minimum of 3 weeks to really get back to activities with a minor sprain. And again, if your pain is persistent or the swelling's worsening, then we do recommend coming in for evaluation.